In today's lesson, we will discuss pericardium and heart. Pericardium, okay. Starting with heart first. Heart, we know this is a vital organ which is used to pump blood to our entire body, and its pulsation are governed by the brain through various nerves. So this is very important. So we always keep our important things in a safe bag, in a case, right? So in this case, in the case of heart, the pericardium serves as the bag or serve as the fibrous layer or protective case which will enclose your heart. So in the pericardium you will find your heart is inside the pericardium. Pericardium is the Greek word which means around the heart. So this is the layer which is found around the heart. It is a fibroserous sac which encloses the heart and roots of the great vessels. It is situated in the middle of the mediastinum. Mediastinum is your cavity behind your sternum which will enclose your pericardium and heart, right? It consists of your fibrous pericardium and serous pericardium. So in this section you can see here, let's just erase these extra lines first. Okay, so this one here, this you can see, this is your fibrous layer, the purple and light pink, right? And in this part, this cavity will enclose your heart. Then this is the diaphragm, and this diagram shows the layers of pericardium. So there is parietal layer of serous pericardium, there is fibrous pericardium, there is visceral layer or epicardium, there is heart muscles inside the pericardium, and there is your pericardial cavity, diaphragm, and we said that great vessels are coming out of the pericardium or the fibroserous sac which we call pericardium. The roots of great vessels are coming out. So here you can see there is your aorta. Okay, let's move on to the different types of pericardium. Before that, when I say border, border means the edges of heart. In terms of surface, surface means the outer area of the heart. Grooves are your indentations or line on the surface of heart. I'm saying heart because in this lesson particularly we will be discussing pericardium and heart. So in reference to that, I'm describing you different key points we'll be using when we are discussing these pericardium and heart. Apex is the bottom tip of the heart and base is the top part of the heart where major blood vessels enter or exit. Now, we said that your pericardium is divided into two parts. This is your fibrous pericardium and then there is your serous pericardium. Your fibrous pericardium, this is your conical sac. So it will look like something like this, how we seen it here. It is forming a bit of a cone here, right? So we say that fibrous pericardium is your conical sac which is made up of your fibrous tissues, because we are saying the name says it itself that fibrous pericardium, so it will have your fibrous tissues. The parietal layer of the serous pericardium is attached to its deep surface with the fibrous pericardium. Now, in the fibrous pericardium, we will see different features. Features like your apex, your base. What are the features in the anterior side of the fibrous pericardium? What is in the posterior side of the fibrous pericardium? So apex, base, anterior, posterior, and what is present on each side of your fibrous pericardium. So let's start with apex. Apex is blunt and lies at the level of sternal angle. It is fused with roots of great vessels and with pretracheal fascia. So all fibrous pericardium, it is fuses with adventitias of great vessels. Then we have base. Base is broad and inseparably blended with the central tendon of diaphragm. So base, you will find the central tendon of diaphragm here on the diagram. Even you can see that this is the base, and then it is fused with your diaphragm. This brown structure is your diaphragm. Okay, now let's carry on further. Anteriorly, on the anterior side, what you will find on the anterior side, you will find your sternopericardial ligament. Function of sternopericardial ligament is that sternopericardial ligament will hold your pericardium in a place so that it can hold your heart in a place when it beats, so it doesn't move around. So because pericardium is a sac, we need something to hold it in one place. So that is the function of sternopericardial ligament, which you will find on the anterior side of your fibrous pericardium, just behind your sternum. So it is connected to the upper and lower end of body of the sternum by weak superior and inferior sternopericardial ligament. Then on the back side or the posterior side, what you will find on the posterior side, you will find a descending aorta and esophagus. You can say that posteriorly the fibrous pericardium, it is related to the principal bronchi, the esophagus with nerve plexus around it, and your descending thoracic aorta. So these are the structures which you will find on the posterior side of your fibrous pericardium. Then on each side you will find the structures related to the phrenic nerves, like your C3, C4, C5, and your pericardiophoranic vessels will also be present. So on each side it is related to your mediastinal pleura, the mediastinal surface of the lungs, phrenic nerves, and pericardiophoranic vessels. So these are the most important part to remember, that you will find on each side of fibrous pericardium your phrenic nerves and your phrenic vessels. So we said that pericardium is divided into two parts, so fibrous pericardium and serous pericardium. On the apex of fibrous pericardium, it fuses with adventitia of great vessels. Base, you will find central tendon of diaphragm there. Anterior side, sternopericardial ligament, which is very weak ligament, attaches the pericardium to sternum. Posteriorly, you will find your descending thoracic aorta, you will find your esophagus and some of the principal bronchi, because of the lungs will be present on the posterior side of the fibrous pericardium. Then on each side related to phrenic nerves, C3, C4, C5, and pericardiophoranic vessels, as well as your mediastinal surface of your lungs and mediastinal pleura, you will find on each side of the fibrous pericardium. Now we know the structures in relation to the pericardium fibrous layer, right? What is the function, what is the exactly function of fibrous pericardium? Fibrous pericardium will protect the heart against sudden overfilling, and it will prevent overexpansion of the heart. So it will serve as your protective layer. Another part of pericardium is your serous pericardium. Your serous pericardium is a thin double-layered serous membrane which is lined by your mesothelium. The outer layer or parietal pericardium is fused with your fibrous pericardium, and the inner layer or visceral pericardium, we say, or another word for visceral pericardium we use mostly is your epicardium, is fused to the heart, except along the cardiac grooves where it is separated from the heart by blood vessels. So serous pericardium, it is divided into two layers, your parietal layer and your visceral layer. Here on the diagram even you can see. So yeah, this is the diagram of serous pericardium, right? And this is your fibrous pericardium on the outside. Then inside, this is your pericardial cavity, and this is the primordium of the heart. So heart will start developing here in mostly in 2 years old babies, right? It will look something like this when babies form, sorry, not 2 years old, 2 months or 2 weeks, right? um uh, and then this is your heart which is growing into your pericardium, right? So we said that visceral layer of the serous pericardium will fuse with the myocardium. Myocardium is the layer of the wall of the heart, and then parietal layer of the serous pericardium will fuse with fibrous pericardium. So this is the parietal layer which will fuse with your fibrous pericardium, and your visceral layer will fuse with your myocardium, which is the layer of your heart. Okay. Now we said that we were here on the serous pericardium. Serous pericardium, it is divided into parietal layer and visceral layer. Parietal layer we said fused with fibrous pericardium. Visceral layer fused to the heart except along your cardiac grooves where it is separated from the heart by the blood vessels. Then in between your parietal layer and your visceral layer there is your pericardial cavity. Your pericardial cavity will contain only a thin film of serous fluid which will lubricate the opposed surface and allows the heart to beat smoothly. So this is the function of pericardial cavity. It will lubricate the opposed surface and it will allow the heart to beat smoothly. This is the function of your serous pericardium as well. And then fibrous pericardium. Fibrous pericardium will protect your heart against the sudden overfilling and prevent overexpansion of the heart. Now, another things which is related to your pericardium is you will find that pericardium have its own content, blood supply, nerve supply, and sinuses. So what are the things which is present in your pericardium or around your pericardium? What are the blood vessels which will supply your pericardium? What are the nerves that are supplying your pericardium? And what type of sinuses are there? Starting with the content of pericardium, heart with cardiac vessels and nerves will be present. That is obvious because pericardium contains your heart, ascending aorta, pulmonary trunk. All the vessels which are coming in, going in or coming out of the heart will be present as a content of pericardium. So whenever you're writing content of pericardium, think about the heart and related structures or related vessels which are coming in or going out of the heart. So heart with cardiac vessels and nerves, ascending aorta, pulmonary trunk, lower half of the superior vena cava, terminal parts of inferior vena cava, terminal parts of pulmonary veins. These are the content of pericardium. Then we move on to the blood supply. Blood supply of the pericardium, it will serve your fibrous and your parietal layer, both of the layers. So blood supplies, the fibrous and parietal pericardia are supplied by the branches from your internal thoracic, musculophrenic arteries, the descending thoracic aortas, and veins that drains into the corresponding veins. So these are your blood supply: internal thoracic, musculophrenic arteries, the descending thoracic aortas, veins that drain into the corresponding veins. Next we have nerve supply of the pericardium. Fibrous and parietal pericardia are supplied by your phrenic nerves. They are sensitive to pain. The epicardium is supplied by your autonomic nerves of the heart and it is not sensitive to pain. Pain of pericarditis originates in parietal pericardium alone, and on the other hand, cardiac pain or angina will originate in cardiac muscles or in the vessels of the heart. So we said fibrous parietal pericardium supplied by the phrenic nerves and they are sensitive to pain. Epicardium supplied by autonomic nerves of heart and they are not sensitive to pain. Then pericarditis pain, it will originate in parietal pericardium, and your cardiac pain or angina we say it will originate in your cardiac muscles or the heart vessels. Here on the figure, you can see figure 18.4, the pericardial cavity seen after the removal of heart. You can see the following structures: superior vena cava, ascending aorta, arterial tube of pericardium, pulmonary trunk, arrows in transverse sinuses, left pulmonary veins. These are your left pulmonary veins. This is your arrow towards the oblique sinuses. Then these are your right pulmonary veins, and this is your inferior vena cava. Then again, here's the structure representing the transverse section through the upper part of the heart. You can see the following structures: atrium, left pulmonary vein. This is your oblique sinuses. This is your right pulmonary vein, your right atrium, ascending aorta, your parietal pericardium, pulmonary trunk, arrows in the transverse sinuses, and this is your left auricle. So let's move on to the sinuses. We said that the pericardium have two sinuses. We discussed the transverse, and we saw the transverse and oblique sinuses in the diagram. So transverse, location wise, it is present between the arterial and venous ends of the heart tube. So transverse sinuses, it is the horizontal gap between the arterial and venous end of the heart tube. It is bounded anteriorly by ascending aorta and pulmonary trunk, and posteriorly the superior vena cava, and inferiorly by the left atrium. On each side, it opens into the general pericardial cavity. So these are the boundaries. Function, which it will function of transverse sinuses. It will provide space for arterial end and venous end of the heart tube to be separated. Next one we have is oblique sinuses. Oblique sinuses is the narrow gap between the heart. It is bounded anteriorly by left atrium and posteriorly by parietal pericardium and esophagus. And on the right and left side, it is bounded by the reflections of your pericardium. And to the left, it opens into the rest of your pericardial cavity. The oblique sinuses will permit pulsations of the left atrium to take place freely. So function allows of the oblique sinuses, it allows pulsation of the left atrium to occur freely. Opening opens into the rest of the pericardial cavity below and to the left. Lateral boundaries bounded by reflections of pericardium on the right and left sides. Boundaries anteriorly by the left atrium, posteriorly by parietal pericardium and esophagus, and oblique sinuses are your narrow gap behind the heart. Your transverse sinuses are the horizontal gap between the arterial and venous ends of the heart tube. Boundaries anteriorly by ascending aorta and pulmonary trunk, posteriorly by superior vena cava, and inferiorly by the left atrium. Opening of transverse sinuses, it opens into the general pericardial cavity on each side, and function provides space for the arterial and venous end of the heart tube to be separated. So this is your pericardium. We discussed that pericardium is divided into two layers: fibrous pericardium, serous pericardium. Serous pericardium have further two sub-layers, which are your parietal layer and visceral layer. Then we discussed the content of the pericardium, the blood supply, nerve supply, which are the nerves that are sensitive to pain, your phrenic nerves, and not sensitive to pain are your autonomic nerves. And then we discuss the sinuses, which are your transverse and oblique sinuses. In the next lesson, we will discuss heart, the external features of heart, and then we will look at the each of the right atrium, left atrium, the right ventricle, and left ventricle in detail. Thank you for watching.